So I think this really depends on the indication that we are treating, as well as the type. Hi, I'm Dr. Mark Lim from the Artisan Clinic, and recently I've chanced upon a couple of questions online fielded about picosecond lasers, so I'd like to answer a couple of them. Very common question that divides the entire world is there a difference between picosecond lasers? I mean, the answer is of course yes. Firstly, you have to divide it into whether is it a 1064 versus a 755 nanometer wavelength. That's one. Then the next one will be that I get very common is, does the pulse duration matter? Is the number of picoseconds important? I'll say that there is some importance to a certain extent. However, at the end of the day, you're still relying on the doctor's skill to diagnose your pigmentation problem. Number two, to apply the proper power setting based on his experience. And number three, to look for the endpoint. So whether is it redness, swelling of the skin, whether is it whitening of the pigmentation or even darkening of the pigmentation. All these factors are important in choosing your doctor as well as machine. Is 1064 the same as 755 nanometers? They are of course two separate wavelengths of light, and with a different wavelength you get different efficiency in terms of clearing pigmentation. So if you compare the two wavelengths on the absorption chart, you can see that the 755 nanometer wavelength has a higher affinity for pigmentation compared to things like water as well as blood. What this translates into is, when you fire the laser, be it a 755 or 1064, the chromophores, which is the hemoglobin, which is blood, pigmentation, which is the brown stuff on your face, and of course water, will compete with each other for absorbing the energy. So if you have a higher affinity for pigmentation, this means that it's more likely that the pigmentation will be broken up into smaller pieces compared to the other particles. Pigmentation will be more efficiently broken down by a 755 nanometer wavelength compared to the 1064. What are the chances of skin discoloration after a Picosure treatment? I'm assuming the patient is referring to PIH or post-inflammatory hyperpigmentation. This is a fairly common side effect that we do see from any kind of laser treatment. Risk of PIH is dependent on a couple of factors, be it patient skin type, indication of treatment, as well as post-procedure care. I think if you compare studies between picosecond versus non-picosecond lasers, you'll find that the incidence of PIH for picosecond lasers is slightly lower compared to Q-switch lasers, which is the older technology. What is there really to see after a Pico treatment? For Picosure Pro, or Picosure for that matter, because of the focus lens, we are able to do acne scar treatments. The scars will be slightly redder or even slightly more swollen for the first couple of days. And it's during this process of the next 2 to 3 weeks, even up to 4 weeks, where we do see collagen stimulation, and then the scar will actually remodel. Surface of the scar will actually get a bit more smoothed out, and the scar will be slightly less deep. Do picosecond lasers have any effect on atrophic acne scarring? So the answer for this is yes. However, in my experience, I found that picosecond lasers, especially the Pico Pro, is extremely useful in treating very shallow and textural acne scars. This allows me to use the laser in a non-ablative setting, which means we do not burn the top layer of the skin, and this actually helps with the recovery and downtime. As such, patients are a bit more willing to accept scar treatments versus, they have to tell me, oh, I have to take 1 week off work, I cannot go out and meet my friends because I have scabs all over my face. So with this in mind, this is a patient who has just had their CO2 laser done and the face is just full of scabs, the face has like a grid on it, versus someone who has just done a picosecond laser and he doesn't have to be a hermit, he doesn't have to stay at home for the next 1 week. This is a little bit more socially acceptable. So at the end of the day, I think it's most important that you choose the right clinic, the right doctor, and the right machine to treat your skin problems.